Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us again. In this segment, we're going to have an interview with Dr. Laura Matrka, Clinical Associate Professor of Otolaryngology at The Ohio State University Wexner Medical Center. She's going to talk about the comprehensive gender-affirming care program for those who are transitioning to find their voice. Welcome to Health Professional Radio, Dr. Matrka. Thank you for joining us.
Thank you for having me.
Why is it so important to offer gender-affirming voice therapy?
Well, as part of the overall healthcare and process, either of transitioning or simply of finding a more true gender expression for patients, voice is huge. If you think about our Zoom culture right now, your voice and your face are the only things that are seen. And sadly, those are the two things that are least frequently covered by insurance. And so not only by providing care, but by lobbying insurance companies and trying to help them understand how fundamental a person's identity is in terms of how it's expressed by voice, can really help with emotional and mental health issues, suicide rates, and even the risk of danger or attack from others in society because of how patients present themselves.
So obviously this has a huge impact on the rest of their lives, expressing themselves and who they really are.
Correct, absolutely. And, appearance is one, but voice is really fundamental and goes right along with it.
So what does this type of surgery entail?
So the remarkable thing is that surgery is often not a part of our gender-affirming voice care here. Okay. And there's a few reasons for this. One is that we happen to have just an incredibly experienced voice therapist in this area. And the other is that surgery can address some limited concerns that are pitch-related, but the gendering of someone's voice is dependent on so much more than just pitch, and those are all the things that therapy covers, usually successfully.
When surgery is the route, what does that entail?
So when surgery is needed, it involves a shortening of the vocal cords. We intentionally create a web at the anterior portion of the vocal cords, which normally in my field is something we aggressively try to avoid. But in this case, it can eliminate the lower end of the frequency range. So what that means is that accidental bass notes or deep pitches when someone's laughing or coughing or something like that are eliminated. And it does that pretty successfully. It also elevates the fundamental frequency, which is just the pitch you go to without trying or thinking.
It sounds very intricate. Are you able to kind of tailor this type of surgery depending on how high or how low based on the pitch that the patient actually wants?
I wish I could say yes, but the truth is that you really, there's a pretty standard way of doing it. You may go for a bigger, smaller web, depending on, what you know about that patient and her wishes. But typically, the idea of fine-tuning to such a kind of minute degree of precision is that's really not possible. And I think it kind of gives you another idea why surgery isn't really something that we jump to immediately, because there are certain things you can accomplish with it, but in no way is it a panacea.
Is transitioning from male to female easier than female to male, or vice versa, when these surgeries are required?
Almost always when we're the surgery I just described is for achieving a more traditionally feminine voice or a higher pitch. And the reason that we see so many more patients in that setting is because of the effects of testosterone. And, this can cross over into some of the legal issues right now, in which it's really important to avoid exposure to testosterone if there is any chance that person doesn't identify with a cis male, a traditionally male gender, because those effects are not reversible. You can you give someone testosterone later and bring about some irreversible changes as well. But for that reason, it can be a lot more problematic to transition to female.
How long does the recovery process normally take, or is it different for each patient and each procedure?
definitely different for everyone. The procedure itself is endoscopic and it's an outpatient procedure. And the recovery in terms of just getting back to activity, eating a normal diet, that all really is pretty quick and not too difficult. But the voice recovery can take anywhere from weeks to months, and it involves a lot of therapy and sometimes other procedures either in the office or operating room to make adjustments. So it's really a wide range of outcomes for patients. We kind of prep them for a wide range of possibilities after surgery.
You mentioned placing this mesh or web in a certain way to alter pitch and things of that nature to avoid accidental lows and things like that when a person is laughing or some other situation. Is the patient required to mentally, I guess, train themselves to change the way that they talk, the way that they inflect, or is the procedure going to do all of this or the majority of this for them?
That's a great question. I'm so glad that you asked that because that question really captures why voice therapy is so important. One example I often give to patients is that there is a range of overlap in pitch. So what's considered a traditionally female pitch, that range actually shares some pitches that are also considered traditionally male. And so it gives you an idea of why pitch is only one thing but not the only thing. Inflection, prosody, the amount of talking, how much you use your hands, how much you vary your intonation and your pitch, all of those things are gendered. And those are things you cannot bring about with a surgery. It has to be done through therapy.
Tell us what other gender-affirming care is offered at Ohio State.
I'm speaking a little bit outside of my field, but as a university and an institution, we do offer a full range of procedures, including urologic and gynecologic procedures. Within my department, we have two specialists with extra training in facial feminization and masculinization, and then, of course, the voice therapy and surgeries we've already discussed.
Tell us how it makes you feel personally when you help patients on their journey to portraying their true self.
Oh, it's wonderful. I mean, I think one of the big points of pride is understanding that a lot of these patients have had a history of just really difficult, sometimes even dangerous interactions with the medical field and with medical providers. And so being able to, just knowing that they can walk into my office and they'll be treated not just by me, but by everyone along the way with respect and understanding. That alone is huge and a big change for these patients, sadly.
Give us a website where our listeners can learn more about Wexner Medical.
They can go to wexnermedical.osu.edu, and there'll be a variety of links from that point.
Doctor, thank you so much for sharing some of your time with us.
Thank you for having me. It's a pleasure.
You've been listening to Health Professional Radio. I'm in conversation with Dr. Laura Matrka. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes and listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.